conundrum that we've all been talking about. So as we know, the Kirkcaldy-Willis degenerative cascade on low back pain was first talked about in 1976, which they talked about the relationship to the different anatomic parts of the spine with respect to degeneration and lower back pain. And I'm sure you've all seen these slides as the degenerative cascade that occurs from a healthy disc going to the loss of H2O and then the change in the collagen fibers within the disc, and that leading to mechanical incompetence and load transfers and the interdependence of the facet joint with respect to the disc, and then being interrelated. And as time goes on and you get disc height loss, the load transfer starts going to the facets, and you start getting loss of disc base height and facet hypertrophic changes, foraminal stenosis, etc. So this is the cascade that we've all been dealing with and see every day in our course of careers. And then when we look at why certain surgeries fail in our years of practice, it seems like the top two choices, the poor patient selection and the wrong procedure, seem to be more common than really poor technique. And then every now and then you see the progression of the disease, which to me is not really failed back. It's just part of the degenerative cascade that occurs. But we look at the origin of low back pain, and there's been many different papers written on this, but 82% of these patients have spine pathology, and then 15% of them have SI pathology. But 12% also have hip pathology, and as you see, this doesn't really add up to 100%. Well, when you look, there's a number of patients that overlap and have combined pathologies of what's going on. So it's really important to tease out the pain generator